I'm Thomas Abercrombie. I'm a healthcare inspector with the Ontario Ministry of Labour out of the Ottawa office.
And I'm Peg Scherzinger, ergonomist with the Ontario Ministry of Labour, and I work out of the Northern Ontario region.
We are at Baycrest Centre, and today we will show you a proactive inspection in a healthcare facility and what the Ministry of Labour inspectors will be looking for when conducting an inspection on MSD prevention and specifically on client handling.
MSDs are musculoskeletal disorders, and what they affect is tissues of the musculoskeletal system, things like muscles, joints, nerves, the discs of the spine. Client handling refers to lifting, repositioning, or transferring of a patient or client.
We're here to see somebody who's in charge of health and safety.
Okay.
When we visit a workplace, we ask to see the management health and safety rep and also a worker health and safety rep. I will ask a Ministry of Labour ergonomist to accompany me when there are MSD hazards in the workplace or if the workplace is experiencing MSDs.
MSD hazards related to client handling include the force involved, repetition, working in awkward postures. Another common source of injury is unexpectedly high forces being placed on a worker due to an unexpected patient movement, such as a slip or fall.
So do you have an overall policy on MSD prevention for client handling?
So the one in the front right now is the ergonomic assessment. We also have our physical demands analysis program.
Do you do some ongoing training too? Would you do annual refreshers?
When we conduct a proactive inspection in the workplace, we begin with an administrative review. We look at measures and procedures. Client handling measures and procedures should be reviewed on at least an annual basis or more often in light of current practice. We look for Joint Health and Safety Committee involvement. We look for training.
So the first thing we're going to do is put the sling around you.
People who should be included in training are the direct caregiver staff, people who are involved in support services such as diagnostic imaging, and staff who may be involved in moving patients or residents in an emergency situation. Supervisors should also be included in this training. What we expect to see from training in client handling is a classroom component and a practical hands-on component.
Has the committee been consulted on the creation of this?
Yeah, we have been involved.
Do you also have specific measures and procedures related to different types of lifts?
In a healthcare facility, the employer has to consult with the Joint Health and Safety Committee on the creation of written measures and procedures.
When measures and procedures are being developed, you want to consider the manufacturer's recommendations for whatever equipment's being used, the size and weight of the client, the medical and cognitive abilities of the client, and the availability of backup equipment.
We follow up with a physical inspection of the workplace. So what type of lifting equipment do you have here?
MSDs due to client handling can be prevented by having the appropriate equipment in place. That could include ceiling lifts, floor lifts, sit-to-stand lifts, transfer boards, and other appropriate equipment.
A client handling device should be inspected according to the manufacturer's instructions.
So this is gonna lift you up and you're gonna feel like you're in a hammock.
Okay.
Okay. So yellow, yellow.
The MSD inspection process should also include inspecting the accessories that go with the mechanical lifting devices.
It's also very important to have measures and procedures on how this equipment is to be used and having staff trained in these procedures. Assessment of clients as to their lift and transfer needs is very important, and having rooms clear of unnecessary clutter to allow the healthcare worker to get in the proper position to do patient lifts and transfers.
When an MSD occurs, the employer must investigate the incident and also put in place measures to prevent that from happening in the future.
Everyone in the workplace is responsible for workplace safety. Everyone should be involved in identifying workplace hazards and helping to find solutions.
Okay. Safe landing.
For a checklist of MSD hazards to be used at the time of your monthly workplace inspection, visit the MSD Prevention Guideline for Ontario.
The MSD Prevention Guidelines can be downloaded at the Ministry of Labour website.